Here are some things that have crossed my neurons. Deltex, they're out there on the stand with their monitoring to ensure patients stay well in surgery. It's a classic quip initiative. It has all of the initials in big, bold case. It improves the safety of patients and lowers patient morbidity and mortality after serious surgery. It starts with a commitment to quality, and that translates into the ability to release quite significant savings. In fact, on their stand, I get, 10 or 15 emails a day from fantastic colleagues in the industry sector claiming to have solved some part of my problem. They're very ambitious. I must say, the one on Deltex's stand is the most ambitious quip sales statement I have ever seen. I think it says, if I'm right, £1 billion in 3 minutes. Is that right? So all we have to do is wait an hour, and it's all sorted. That is an ambitious claim, but it's a fantastic example of technology. What I know is that if that's then brought into theatre in an additive way, in a way that the staff are using it alongside other machines that they don't understand, then that quality and cost gain from day one will be eroded away to nothing. You've got to have rigour and discipline and drive the old out and replace it with the new and train and support people if you want to release the value, not just spatter new technology onto old. I was privileged some while ago to go up to the Broomwell Health Centre in Manchester. Such a simple idea of the most, not anything like the upper end of the complexity of telehealth. There's some extraordinary telehealth on display in the exhibition today, and it's all got its place. But this is, I think, at the simpler end. And yet for the patients concerned, patients with cardiac conditions, the reassurance it brings, the confidence to live their own lives, and the direct reduction in people escalating up the system into hospital when all they need is reassurance that what they're experiencing is normal, is extraordinary. The Broomwell story is most interesting because despite having some of the lowest entry costs, the most outstanding results I've seen, and simple to make happen in any place, they have continued to suffer the difficulty of market entry for a simple, low entry point, easy to administer technology. The system that I'm part of and you are seems to actively resist these ideas, not go out for them with hunger and desperation to implement, and we have to invert that, and I'm going to say some more about that at the end. I met some colleagues from MyAmigo, and again there are some similar technologies in the demonstration area of just monitoring people's physical location. One of the most distressing recent statistics I've been made aware of is the level of deaths and harm from the people we over-medicate to control their dementia. It's not just the loss of dignity and basic human life because of the medication. It's a toll of human death and suffering as a result that's really quite disturbing. And one of the reasons it happens is because we're anxious about managing the patient with severe dementia, and so we over-control them. If you just create an environment in which you know where people are and know what their limits are and are confident that they can, that they're working within them, and I've seen 2 or 3 examples like the MyAmigo system today, you begin to liberate the lives of those patients. You save that litany of death and harm, and by the way, you save the money that's required when you escalate those patients' care. It's human dignity, it's quality, and it saves money. And again, its entry cost, like many of the technologies in the house today, is low. The problem is in our culture and attitude and response, not in the technology system. But at the other end, there are also some just extraordinary things. And I was introduced to Proteus a while ago, which is, if I get this right, it's a computer made of food on a tablet. If you want the more technical explanation, you seriously need to go to someone else. But a tablet that knows when it's been taken and communicates that with computers and support systems. When you look at the QUIP agenda about the amount of interventions that we seek to make to improve people's health, about medication regimes that are then simply not complied with by patients, that are thrown away, that are misused, a system that helps patients and their carers and clinicians, and again I've seen other examples today in the House, to know and have confidence that the treatment we're trying to use is being used. One of the quip scandals is the money we spend on drugs that we throw away. I've said to the pharmaceutical industry, we're not seeking to save lots of money from drugs. We just don't want to spend it on things we throw down the toilet. We want to throw it on things that patients take and make a difference to their lives, and there are some extraordinary technology. So it's just meant to illustrate the range, and there are hundreds more in this building and thousands more beyond that. In terms of the core ingredients of innovation, to use the American phrase, we're drinking from a fire hose. You know, the problem is not the lack of potential, fantastic, proven ideas. The problem is us and our skill set and our cultural approach to looking for those hungrily and making them happen. I want to mention one last little group, which I call technology, but I'd almost say it's kind of not really technology, it's simple solutions. I've gone around over the last 2 days and been fantastically impressed with the high end of technical stuff, but the things I've liked most are the very, very simple things that are just so easy to do. And one of the ones that I saw recently that I just thought, you know, that's something is a simple system, this one's called the hydrant, for just making sure patients in hospital beds can drink the damn water that we give them. You know, the impact of dehydration on patients' wellness is extraordinary. It's extraordinary. We contribute massively to some of our core indicators about death, about outcome, about length of stay, just from whether the water is consumed or not, whether elderly, frail patients are hydrated or not. And I mean, you like me will have seen committed, vigorous, caring staff putting the water by the bed, putting the water in the cup, and the patient not able to drink it until the other member of staff comes to clean that away. And it's fantastic to see very, very simple ideas, cheap, easy to implement, tackling the most basic problems. Potentially one of the ideas with the highest return to investment ratio I've ever seen. So the problem is not the technology. The problem is us. How do we get the things we know about to happen at scale and pace? Interestingly, I'm privileged to have spent some time learning about this with international colleagues. I don't think it's an NHS problem. There may be some particular NHS components, but it seems to be a problem internationally in healthcare, which is dissemination is slow and ponderous. Maybe because we are necessarily quite a conservative industry. You don't want to rush always to be doing some new heroic intervention on a patient's body. It's the right thing to do proper, careful clinical trials before we do that. But I'm not sure that applying that same logic to a water jug that works is rational. And I think we do. I think we have adopted this very, very cautious, slow pace of change and created very difficult barriers as a result. So we, in the classic sort of dissemination curve, you know, Rogers' dissemination curve, which everybody talks about, and which always has this chasm in it. Our chasm is the Grand Canyon of chasms. It's really hard. We've got thousands of examples of innovators and early adopters. How many have we really got where those early things spread organically, quickly across the whole system, where people fought to go out and find them? And I've got two sets of suggestions to make. One is about us, and the second is about the new system of care. So this is, I'd like us to think about when we leave the room, what are the things that we are going to do ourselves, because that's where change starts with us, to change that. It's great that you've seen this stuff. You need to make it happen.